So this conference, I attended it last year, and I found it really, really helpful. I think in the way forward, in how do people feel, why are we doing what we're doing, can we do it better?
Thank you.
But we respond to about 200 calls a day just in London around mental health crisis incidents.
If you're in a senior management position, how do you know that pain isn't being used?
I decided I would use Huckshaw's 6 core strategies because it was a model that could be easily adapted to an educational environment.
Where is the debriefing and support for people who have been witnessing it? 'Cause it can be as much of a trauma as if you've been part of it yourself.
So co-production, co-delivery and recovery is absolutely vital to work together with people like me and Sam and so many others.
We're actually restricting people's lives and having a huge influence in terms of their quality of life by some of the practices we adopt, but we haven't got a label for it, so we don't record it anywhere.
We have to shift resources from what I would call containment to prevention to early intervention.
One slide about what the 6 core strategies are and its leadership. Considered the most important core strategy. Without it, it doesn't happen.
It's been great to see so many people coming together and sharing some really good practice. And I get a sense here that people want a single national accreditation scheme established, which will certainly help to raise standards across all services. And that's been really, really good.
So for me, there's a number of questions.
This is the 3rd conference of the Restraint Reduction Network. The wonderful thing is the impetus is still there. We seem to be attracting a wider audience as well this time, including much more of the educational agenda and the social service side of things rather than just mental health and learning disabilities. They're all important and we all need to be in the room together.
Whenever you want to implement something new, it is a challenge. But if you look at what other people are doing within their trust, you get new ideas of how to deal with situations.
The biggest show of respect is actually control. Giving the control back to somebody else rather than the staff control.
The issue of intimidating people, controlling their lives, controlling what they even think sometimes, is as damaging in the short and long term. We have to create cultures where that is not allowed, but it's not even thought about. And staff taking responsibility for each other.
We don't co-produce, we try to debrief, we try to reflect, we work with parents, and this next hour or so will be crucial for us in our strategy around this.
Coming here, it's about a shift in culture of staff, getting away from, we can sort that problem out because we can restrain that patient. Actually, what can we do to work with that patient to get the same outcome?
One of my concerns is that there's not often enough what we call navel gazing, so self-reflection on what could have been done differently from a staff perspective on debriefing. The talk this morning was really very interesting from Paul Dix. I really liked his angle, especially around staff responsibilities.
And all the work we do around culture and shift of climate is around shifting adult behaviour deliberately, strategically, so that we get the outcomes that we want and reduce the restraint. And in the end, a restraint system or a process is only as safe as the adults who are operating it.
I was really keen to talk to the leaders of the mental health trusts in the West Midlands to say, will you go with me on this journey?
Norman Lamb has been a key champion of the Restraint Reduction Network, and I think we're delighted that 1, he's still very supportive of us, but 2, that he's continuing to drive the agenda forward on the matter of accreditation.
There has to surely be mandatory accreditation of training. At the moment, there's just too much variation. We have no real idea about who is providing training across the system. And if you're not trained properly, you can't blame the people who are working in these institutions who know no other way.
I think accreditation is the best thing which you can have. And at the moment we are utilising the BUILD, which is an independent accreditation.
Yes, there should be a focus on accreditation, and I think we should be very clear about the standards that we require from any restraint programme. And I think the government does have a role in that, but also, that the sector has a role in trying to influence those decisions and to get our checklist of what we believe works best.
It's obvious to me that if staff are well trained,
you are likely to reduce the need to rely on police officers to come and regain control of a patient, for example. From a police point of view, we don't want people that are experiencing a mental health crisis being detained in a police cell.
When I have acute admissions, I put paper on the mirror. If I can't see myself in that mirror, I can't be alive, I can't be restrained.
You listen to service users who are keynote speakers that tell you their experiences and how they've felt when being put into restraint is just heart-wrenching at times and so powerful, such a powerful message.
The whole notion of trauma-informed care, which Janice LaBelle has talked about at our conference today, is really valuable and so important in changing hearts and minds, I think.
I'm so passionate about the 6 core strategies as an approach to addressing an organizational problem like the use of restraint and seclusion because it works.
When I talk about leadership, it is committed senior leadership, but it's also the inherent leadership within each and every staff person who is charged with doing this work to carry it forward.
Really enjoyed Janice's, that were a really good opening, but everybody's been absolutely fantastic, it's all been great, it's just been so inspiring and motivating. It's been great to meet lots of people that have already done some really good work and made really good networking contacts.
Never been to the conference before, and I've really found that there's elements from all the different parts of the presentations that I can take back to our trust.
We really want to start making the network much more proactive in terms of engaging the members, putting them in touch with each other, looking at possible exchanges to go to areas of best practice.
We'll be here again next year promoting the work we've done.
Definitely I'll come back. I've already applied for the next one next year, and I'm looking forward for us to also do our own workshop from our organization as well.
I have to go on advice that I get from people working in mental health services, but for me as a layperson, I can't see how you can achieve good therapeutic care and indeed recovery if force is endemic in inpatient settings. So for me, trying to reduce the use of force is a real moral imperative.
At the end of the day, my message would be watch very carefully language, tone, controlling behaviours that remove from the individual their whole sense of worth and who they are.